How's the NHS, which is 75 today, changed in the time that you have been involved with it?
Yeah, so I still work as a bank nurse and I've been working in the NHS for over 30 years. It's changed a huge amount. When I go back and do bank shifts now, the patients that are in hospital are often much sicker. You know, when I was training, if you went in for surgery, like for a hernia or varicose veins, you're in for nearly a week. They're all day cases now. And when, you know, a good example that I give is patients with HIV. When I was a student nurse, I used to look after patients dying of AIDS. And now people with HIV can live, you know, lives where they're not passing on the virus to partners. They're able to have children because of the medicines and advances in the treatment of HIV.
Which is amazing and superb and fantastic. But we've got a big number for you, £7.4 million, 7.4 million people, forgive me, in the backlog waiting for treatment.
Yeah, so what we are doing in England, and we're only responsible for healthcare in England, is we are getting those waiting lists down in terms of how long people are...
Up though, haven't they?
Well, what I would say to patients, what matters is how long they're waiting. They're not really worried about who else is on the waiting list. They want to know when their procedure or operation is happening. And we've significantly reduced that delay. So we've virtually eliminated the 2-year wait.
This number is 7.4 million.
But that's the number of people, and that probably will go up higher because we're offering more procedures.
So it's going to go up even higher?
So what I'm saying is, but the length of time people are waiting for their procedures is actually going down, and that's what matters to patients.
So what's it going to go up to?
So, but what it's going to go down to is that we've got to...
You said it's going to go higher, so what's it going to go up to?
We've got the 2-year waits down, we've got the 18-month waits down, and we're now working on those waiting for a year to try and get those waits down further. In Wales, where Labour run the NHS, there's thousands of people...
Talking about that massive number,
Well,
and you said it's going to go higher, so I'm asking you, reasonable question, how much higher is it going to go?
I think it's important for people in Wales to know that they're still waiting 2 years because the same interventions haven't been put in Wales. There will always be people being added to the waiting list because we're introducing more procedures, we're able to treat more.
So it's never going to come below 7.4 million?
I'm not saying that, but I'm saying that there will always be people waiting for procedures, whether that's outpatients procedures, operations, investigations. What matters to patients?
No, what matters is how many people are on the waiting list. You said that number, which is massive, is going to go higher.
Well,
I'm asking you...
We've always been very clear that after COVID, when routine procedures were shut down, quite rightly, to protect focus on COVID, we always said that the waiting list would go up before it would start to come down. So it will start to come down. But
go up?
So it will go up before it comes down.
I've given you enough chances now to clarify whether it was a misspeak or not. If it wasn't, if it's going to go higher, it's reasonable to ask you how much higher it's going to go.
So, you know, what our focus on is the waiting. Well, because what's important to patients is how long they have to wait. And in England, we're able to say to patients, you're not waiting 2 years, you're not waiting 18 months, you're waiting less than a year, and we want to get that down further. That's when I see constituents in my own surgeries in my constituency, they want to know how quickly can I get my hip operation done, how quickly can I see the consultant, and when we're able to say that that is reducing all the time through our investment and the hard work of NHS staff, they're not worried about who else is on that waiting list. They want to know how long they have to wait.
If I may, I allowed you to answer that question. I said that number of 7.4 million was higher, and you said it will go higher before it comes down. So you must have an idea how much higher it's going to go. That's my question.
Well, you know, that's a clinical decision when people go onto the waiting list. But we have always been clear
when
we were coming out, because, you know, I'm not going to say a figure.
Why not?
Because there's a whole range of reasons why people go onto the waiting list. It may be for operations, it may be for investigations.
But it's going to get worse before it gets better.
We've always been clear about that. And the Prime Minister has been clear that getting that waiting list down is one of his key priorities. But he's also been honest that that will go up before it comes down.
OK, you're embarrassed by that number?
I think it's tremendous that, given that number on that waiting list, that we're able to get people seen much quicker than they were this time last year. So this time last year, people were waiting for over 2 years. We've managed in a very short space of time to virtually eliminate that. In April, we were able to say that over 90% of people were no longer waiting 18 months, and now we're focused on the people waiting for a year.
Why is that number so high, do you think?
Well, because we closed down the health service for 2 years to focus on COVID.
Not just the pandemic, though, is it?
But that's a massive...
Not according to the former Health Secretary, who was also former chair of the Health Select Committee. He said the NHS in England, when he was chair of the committee, now the Chancellor, of course, the NHS in England is short of 12,000 hospital doctors and more than 50,000 nurses and midwives. He said that had been a problem that was getting worse year on year. He also said the number of full-time equivalent GPs fell by more than 700 over 3 years to March 2022. That takes us back to March 2019. We weren't in a pandemic then.
No, absolutely. And that's why we've introduced the long-term workforce plan. We've been training more doctors and nurses. So compared to this time last year, we've got 12,000 more nurses, 5,000 more doctors. In my area, which is mental health, we're recruiting 27,000 more staff. We've already reached that 20,000 number. So we're putting record numbers of staff into the health service. And with the announcement last week of the long-term workforce plan, that will be on an ongoing basis, so that over the next 15 years, we've got a pipeline of a range of healthcare professionals with a range of ways of entering, from apprenticeships to associate routes to flexible learning and more clinical-based learning,
Can you
which will
accept that
future-proof the staff.
Can you accept that it's not just the pandemic that has exacerbated?
In my 30 years of working in the NHS, there's always been challenges.
You accept that it's not just the pandemic?
Of course. There are challenges in healthcare, which are the same challenges that Labour face where they run the health service in Wales, and actually their waiting lists are much higher than ours, or where the SNP run the health service in Scotland. They're challenges that all healthcare systems around the world are facing right now.
Sajid Javid and Tony Blair both suggesting that some patients should be charged for using the NHS. Good idea?
Well, I know that, Tony Blair has also come out and said that he wants to see more private healthcare being available and for people to start paying towards that. That's not the position of the government. We're absolutely clear that the NHS is free at the point of use. People pay for the NHS through their taxes and national insurance, and they pay quite a lot of money towards that, but it will remain free at the point of use when people need it.
OK, the leader of the opposition writing in the Daily Mirror to say that we should embrace new technologies, focusing on preventing illnesses in the first place and ensuring we have more care in the community. I'm guessing you agree with him.
Oh, absolutely, and that's part of the work that we're doing. Part of the work is making sure that any research, we've just announced 96 billion for research development, is to get that embedded at the bedside so that patients are getting full advantage. One example, for example, is the Royal Marsden, who are now using new AI technology so that when they're looking at scans, the lumps and bumps that are not necessarily visible to the human eye, AI will pick that up and be able to guide those radiologists as to whether that's likely to be cancer or not. So, this technology is actually big embedded throughout the NHS as we speak.
Veterans Minister Johnny Mercer on the programme yesterday, I'm sure you're aware, Twitter lit up when he suggested that it was a choice for people to want to use food banks. He then was more specific and said it was a choice for military personnel if they want to use food banks. Do you agree with him?
Well, people do need to, use food banks. I know in my own constituency that there's a range of people who do very often at a time of crisis need to be able to access food banks. And, there's a huge amount of support for those in the communities.
Shouldn't have to be, though, should they? We shouldn't be using food banks in 21st century Britain.
Look, I grew up in a very poor background.
So did I, but we didn't use food banks. Well, we didn't need to use food banks.
We had to get food parcels. There weren't food banks in my day, but we did used to get help and support.
With respect, that was a while ago, and I'm guessing, and it certainly
But
was.
you said that has never happened before, but absolutely that has been happening over time.
So it's okay?
I'm not saying it's okay, but people do struggle, and it's really important that when people do struggle, that help and support is available. But to pretend that people have been struggling is a new thing is absolutely not the case. As you say, it was a while ago that I was a young child, but we used to get help with uniforms.
With disrespect.
No, of course, it's true. But I used to get help with uniforms, we used to get help with foods, we used to get help with, and that's what communities do. Whether it was the church in my day or whether it's food banks now, that's how, we should be supporting people.
But we're paying our military enough and they shouldn't be using food banks.
Look, I'm not going to comment. I don't have enough knowledge about the military, but I do know that, in my constituency, people do need help, and it's right and proper that we support them when they do. And the government has been giving record amounts of support this year, particularly with the energy crisis. We've been paying half of people's electricity bills on average across the country.
That's stopped now.
Well, absolutely, because energy prices are now starting to come down. But when people need help, whether that was through COVID, through things like furlough, or whether through the energy crisis with paying half of people's electricity bills, we do step in when we absolutely need to support people.